My name is Trisha J. Hogan. I'm a second year pediatric resident at UNM. This is our adolescent medicine rotation, and I'm going to be giving a talk about adolescent contraception, and then also a slightly related topic on healthcare consent and confidentiality here in New Mexico. So two topics, not totally unrelated, but there'll be a little break in the middle. So why are pediatricians the best people to address this problem? That's because we develop long-term relationships with patients over the years of caring for them that allows for trust, and then able to identify and intervene at the onset of sexual activity for a large proportion of our patients. Kind of along those lines, only 6 out of 10 practicing pediatrician members of the AAP report addressing issues of sexual health and contraception in routine preventative care visits. So it's a big problem, important to pay attention to. Adolescents often start having sex in New Mexico. We'll get to a slide on that. Anywhere from age 12 through 17. In 2011, 47% of high school students reported ever having sex, and then 34 within the previous 3 months. Negative consequences of inadequately protected sexual activity include, of course, unintended pregnancy and sexually transmitted infections. Along those lines, New Mexico has the highest teen birth rate in the nation right now. Here's a little slide on teen sexual activity in New Mexico from the CDC, Department of Adolescent Health. It just is going over the percent of high school students who have ever had sexual intercourse compared in New Mexico to the United States as a whole. So at age 13, New Mexico is obviously higher, total for both males and females, as well as percentage of high school students who've had sex with more than 4 partners. New Mexico compares to the national average there. And then the percent of high school students who've drank alcohol or used drugs prior to their last sexual intercourse. New Mexico is obviously slightly higher than the national average, especially in female adolescents. So for adolescents, commonly used forms of contraception are condoms is the number one. 96% of female teens report having used condoms during at least one sexual encounter. That's definitely not even all sexual encounters. 57% of teenagers use the withdrawal method. And then the third most common is the oral contraceptive pill. Only about 4.5% of adolescents in 2009 reported using a long-acting reversible contraceptive such as an implant or an IUD. So I want to talk mostly about LARCs, so long-acting reversible contraceptions for adolescents, for a couple of reasons. It's the recommendation of the AAP and of the American College of Gynecologists and Obstetricians that LARCs are the most effective and safe method of contraception for adolescents, and that's because of a high satisfaction rate and a low discontinuation rate. So continuation rate after 1 year of using either an IUD or an implant is 86% versus 55% for short-acting methods like the pill or regularly using condoms. They don't require daily maintenance. It's not something that a teenager has to remember to do every day. It's a one-time thing and then you're protected. And then the side effect profile is also very low. They are safe in adolescent patients despite concerns early on. They are very safe for patients. So first I'll talk about IUDs. IUDs are inserted into the uterus to provide long-acting contraception. They're generally safe and they have a failure rate of less than 1%. There's 3 that the FDA has approved, copper, and then 2 hormone releasing T-shaped IUDs. That's the Mirena and the Skyla. Here's a picture of all of them. So on my right is the copper IUD or the Paragard. In the middle is a Mirena, and then there's a Skyla on my left. So here's a chart that compares all 3 of the IUDs. This one is from bedsider.org, which is a website that goes over adolescent sexual health. So the Skyla is good for up to 3 years. and is slightly narrower than the Mirena. That works by releasing a low amount of progestin-containing hormone. Mirena is slightly wider and is good for up to 5 years. Paragard has a small amount of copper. It does not have any hormones. It's kind of in between the Mirena and the Skyla in terms of width, but it is good for up to 12 years. The mechanism of action of an IUD is to prevent fertilization by inhibiting sperm motility. They also thicken cervical mucus. Contrary to popular belief, all of these mechanisms occur before implantation, before pregnancy begins. And in fact, inhibiting implantation is not a primary mechanism of action for either type of IUD in preventing pregnancy. That's kind of a common misconception among even healthcare providers. So side effects, other than irregular bleeding, adverse effects are not common, but can include emotional lability, weight gain, headache, and acne. Evidence suggests that the relative risk of pelvic inflammatory disease that we hear about a lot is increased only in the first 20 days after insertion and then returns to baseline of any teenager, while the absolute risk remains small. Expulsion rates are also low. They do not affect long-term fertility and are not technically limited in terms of placing an IUD in an adolescent patient. It's the same as placing it in an adult patient. The other kind of long-acting reversible contraception is the implants. There's two that are available right now, the Nexplanon and Implanon. They're a single rod implant that contains also a metabolite of progestin. It has a failure rate of less than 1% as well and is good for 3 years. There's even evidence coming out now that they're actually probably good for longer than 3 years. And so there's no rush to get it in, get it and replace a new one too, which makes it an even better choice for an adolescent patient who might be making their own appointments for themselves. So implants in adolescents are ideal because once again, they don't require a daily maintenance and then offer an extended length of protection. Side effects include irregular bleeding as well as any other kind of hormone-containing contraception. But in fact, they might be of benefit because patients, the most common side effect in there of irregular bleeding is amenorrhea. So if someone is has heavy periods, it can often lead to a higher hemoglobin level, and also has the most minimal effect on weight of all progestin containing birth control methods. And that's kind of what I was talking about. You hear a lot about irregular bleeding with the implant. So the most common is amenorrhea. 21.4% of patients who get the implant don't have a period anymore. But it does remain the most common reason for implant discontinuation. So in review, long-acting reversible contraceptives are highly effective, require little maintenance, and have favorable side effect profiles, and so are ideal for adolescent patients. Some barriers are that they do require specific training for providers and are often more expensive at onset than shorter-acting methods like condoms or birth control pills. But currently under our health insurance law, they are covered by all insurance plans. So now I want to talk about consent and confidentiality, a review of New Mexico's laws there. So consent, minors can consent to contraceptive services, STD, HIV testing, but not treatment, HPV vaccination, pregnancy testing diagnosis and prenatal care, abortion services, placing a child for adoption, and outpatient mental health services. Parental consent is needed for dropping out of school or marriage, which can kind of key into there. So if a patient does become pregnant, they can't assume total care of their needs. And we do not currently have a law or a policy on obtaining Medicare for a child of a teen or treatment for alcohol and drug use. So the laws about reproductive health and consent, like I said, includes treatment and testing for STIs, pregnancy-related services, and contraception. The only kind of thing to talk about there is that parents may be able to access results of STD testing upon request. Treatment remains confidential, but parents can also get a hold of that information if you look at your insurance billing. Mental health services is another special case. So if a child is under 14, they can consent to an initial assessment without any kind of medication or prolonged therapy. But if you're over 14, then you are assumed to have a capacity to consent to treatment. So types of consentable mental health services would include, of course, a patient over 14 would include individual or group psychotherapy, case management, behavioral therapy, family therapy, counseling, and substance abuse treatment, which I think is interesting and important. So that's why I bolded it. Mental health in terms of medication, children 14 and older can consent to psychotropic medications within the informed consent of the child and notice to a parent. If the child over 14 lacks capacity, there is our mental health court, and so there's a process for a parent to gain, to act as a surrogate of their decision-making capacity. In terms of confidentiality, generally a parent has access to all of their child's medical records. Kind of along the same lines, there are those exceptions. So minors' consent to care and consent of a parent is not required under state law. Minor obtains care at the direction of a court, so like an emancipated teen, or the parent agrees to a confidential relationship, which is what we would all hope would happen if they have a good relationship. Confidentiality for reproductive care. The laws in New Mexico are actually very limited. Test results for sexually transmitted diseases, like I said before, may be released to both the subject of the test or the subject's legally authorized representatives, such as a guardian parent or legal custodian. Mental health, when the child is under 14 years of age, the legal custodian is authorized to consent to disclosure on behalf of the child, and so they can get a hold of that information. When a child is 14 years or older, that kind of changes, and the child has the capacity to refuse. There are my resources. Bedsider.org is a good resource to give your teenage patients because it's really simple information, but it's also comprehensive on reproductive health. That's it.